Good morning, everybody, and welcome back to the HerStoryTV and the HerStory podcast. This is Getrude Matshe here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating lady coming to us all the way from the United States. Welcome, welcome, welcome to our tribe.
Hi, thank you.
Please tell everybody your full name, where you're based, how old you are, and share your story with us today.
Yeah, I'm Dr. Ellie Heintze. I'm from Bothell, Washington, and I'm 37. And my story starts decades ago when I was actually getting a master's degree in chemistry. And at that time, I really didn't know where I wanted to take that, but I knew somewhere in medicine is where I wanted to go. But it just so happened I was having really bad digestive issues, and I went to several doctors, and they kind of dismissed me. All my labs were normal, so like, well, there's nothing we can do. And I was really frustrated because I was in pain, and it was really affecting my day-to-day activity. And I was not sure about the next step, but I remember actually walking home from a gastroenterology appointment, and I walked past this office that I've walked by many times, and I didn't really know what they did, but it was a naturopathic medical office, and they also did acupuncture. And I was like, well, nothing else, no one really is listening to me or believing in me that I'm in pain. Let me just go to this doctor and just see what they have to say. And I really didn't know anything about acupuncture or what they could offer. So I made an appointment and I went in, and it was the most professional, clean, inviting environment. And the doctor listened to me, listened to my whole story for about an hour or even longer. And he was like, let's do some lab tests. Let's really see what's going on. And he had some ideas about what it could be. But he's like, well, let's get you feeling better while we're investigating. And he did acupuncture on the first visit. And I didn't know anything about it, but it was such a great experience. But I left feeling better. And it was just so comforting to know that there was a form of medicine out there that would listen, doctors that will listen to you, but provide healing in the meantime. And that really pretty much changed my whole life, because I knew that is what medicine should be like. And I found out where he went to school, and I applied to that school, and I quickly finished up my master's degree in chemistry. And I went on this, would be a 7-year journey to become a naturopathic doctor and acupuncturist, because I knew that was really how I was supposed to help people.
Wow. And did you ever finally diagnose exactly what it was that was wrong with you?
Yeah, I had food allergies. And
Oh, wow.
at that time, food allergies really weren't mainstream as they are
Yes.
now. And so it didn't even, honestly, it didn't even occur to me that I could be allergic to something that I was eating. But that was one of the first things that he thought of. He's like, well, I suspect you may have some food allergies, but I don't know what they are. But let's look at everything. And he did
Yes.
a pretty extensive lab panel. But it turned out that I was allergic to eggs, and I had
Oh,
no idea.
wow.
Yeah. Yeah.
And this is the thing about food, right? That our
Mhm.
food is really our medicine, or it can be our poison as well if you
Mhm.
are eating unconsciously and you're not aware of the impact that food has on your body.
Yes.
So you delved further on. Her story is all about women. We're always looking for interesting women who have different methodologies to help women, especially health wise.
Mhm.
You've specialized in women's health.
Mhm.
Tell us all of the aspects and the areas that you help women with.
Yeah, I would say 90% of my practice, I see women, and it
Mhm.
ranges. Many different conditions. Probably the number one thing that I do see is infertility, and a lot of PCOS or polycystic ovarian syndrome is quite common. A lot of anxiety and stress, but probably the number one thing that I do see women for are fertility issues.
Wow.
Mhm.
Now, I know that for most women who are going through this process,
Mhm.
sometimes the stress really can take its toll,
Yes.
especially on a woman's body. If you were to have a patient, or let's say there is somebody who's tuning in right now and listening to this interview,
Mm-hmm.
walk me through the steps you would take one of your patients and what they could expect.
Yeah, just to give an example, if I have a woman coming in and say they're going through IVF treatments, a
Mm-hmm.
lot of my patients, they've been doing that for a couple of years, and they
Yes.
get to a point where it's really frustrating, and it takes a big toll on not only their energy but their emotions, kind of emotional roller coaster through trying IVF for a long time.
Mm.
And either they hear somebody who went to acupuncture to help them with their fertility, or actually their reproductive endocrinologist maybe has suggested it. And so by the time they actually get into my office, I kind of meet them where they're at and see what their goals are. Because everyone
Yes.
has a different timeline and what their goals are. And so figuring that out is the first step to see
Mm-hmm.
where to go from there. But I would say the number one thing that people really like about acupuncture, especially if they're going through IVF, is stress relief, and taking time out for them for self-care can be really important.
So tell me a little bit about acupuncture and how it all works. I have a fear of needles. I would
Mhm.
never put myself down on a table to get pricked,
Mhm.
deliberately. But how does it work?
Yeah, acupuncture, they are needles. I call them points because they're friendly. A lot of people really don't feel them going in at all, and most people find it actually really relaxing. Um, but acupuncture works by helping your body heal itself. And so that's what our body is designed to do. It kind of helps us in that direction. And acupuncture has been shown in studies to help our body produce more endorphins, which is our feel good hormone. It also can help with pain relief in the same manner. And kind of the basis of it scientifically is that it takes us from a fight or flight or sympathetic state that a lot of people are in every day to a parasympathetic state, which is our repair and rejuvenation mode. And that's really where our healing takes place. It's why we need to sleep at night, so we can heal our body. Acupuncture can tune you into that state, and that's how people can heal from many different conditions.
Wow. Now, you have been in business, your own business, for a long time,
Mhm.
and that comes with its own
Yes.
stresses, especially
Mhm.
as a woman in business. How do you balance your work life in terms of
Mhm.
being a doctor? Probably you have a
Mhm.
family, a
Mhm.
partner. How do you juggle those two things?
That's a really good question. And I would say over the last couple of years, I really changed how I did my practice so I wouldn't burn out. And I think,
Yes.
as any business owner can attest to, there's a lot of moving pieces in a business. And sometimes we can um, get overwhelmed with all those different pieces, and we
Yes.
can kind of forget about ourselves and focus 100% on our business. And for me, I realized what was happening in that situation, and I knew I needed to make changes in how I did my practice. And so currently I have kind of staggered hours during the week. And so I have some afternoon days and I have some morning days. And so I created a routine that really works for me. So I know exactly where I can fit in my exercise and other activities that I do outside of my clinic, and really separate it out. That when I'm at clinic, it's clinic time, and when I'm at home doing other activities, I can be 100% present.
Mm.
And that really has made night and day difference in not only my energy, and now I really, really enjoy, not that I didn't before, but I really enjoy being at clinic because I feel energized and refreshed.
Now, I don't know how things are for you in the United States. The world is in a bit of a turmoil at the moment in terms of
Mm-hmm.
what's going on with COVID-19.
Mm-hmm.
How are you managing to continue helping your clients for a start?
Mm-hmm.
And can people get access to you
Mm-hmm.
virtually? How does your how have you been affected and how
Mm.
have you continued to work?
Yeah, that's a really good question. I would say initially when all this started last March, um, we're in Washington State, and our state set out really clear guidelines to help health providers know how to operate. And acupuncturists were considered an essential provider, which was amazing. And so we were still able to be open and operate and see people, but with guidelines put in place. So
Right.
we still do them, screening checks before they come into their appointment, like have they been exposed to anybody or have any COVID symptoms, taking people's temperature, um, making sure they're using hand sanitizer and washing their hands, and everyone
Yes.
does need to wear a mask. And people really, really love that. They feel very safe and comfortable coming in to get treatment. But what's really good about what we do is we're able to serve people. And so they're able to get pain relief or help from many different conditions. And so it puts less pressure on people going to like urgent care or their primary care for those conditions, to
Mhm.
open that space up for people who really have like urgent care needs. And so I'm really glad that our state recognized that and allowed
Mhm.
acupuncturists to continue seeing people during this time.
That is absolutely wonderful.
Mhm.
Now, I know that sometimes when you are not feeling well, you know you're not feeling well. Your body
Mhm.
is giving you all the signs, all of the symptoms. And then you go into a medical practice, you try and explain what's going on, and sometimes you're misunderstood, or the health
Mhm.
practitioner is not really tuning into what you need.
Mhm.
How can you trust yourself that you are not well? Because sometimes you end up thinking, am I crazy? Am I missing something?
Mhm.
Because some conditions are easily missed by, traditional medicine, correct?
Yeah, that is true. I would say the first thing that I would recommend is if you've been going into your doctor and you just feel that they're not listening to you, or maybe there's some testing that you want them to run, but they're just not doing it. I would actually get a second opinion. It's totally okay to find another primary care provider. And I usually tell my patients, since I don't do primary care in my practice, I do help them find one that maybe is a good fit. And I think a lot of people don't know that they can do that, and they can be an advocate for their own health in that way. That if you're not being heard by that person who's supposed to help manage your care, it's okay to find another person that will be a better fit for you.
Then you do have choices, you do have options,
Hmm.
but sometimes we do feel like you're restricted.
Yep.
So let's go into food.
Mhm.
From what you have learned from the different types of food that affect people in different ways. I know you can't, sweep through
Mhm.
everything, but which types of foods can cause illnesses in people that can be missed traditionally?
Yeah, that's a really good question. I could talk for hours and hours about food allergies and food sensitivities. But I would say probably the number one thing that I see in my practice are there a lot of people who just can't eat gluten, which is a protein found in wheat. And I know gluten allergy or celiac disease has become more well known. A lot of people have heard about it. And there's just a lot more studies being done about gluten itself, on what it actually
Mm,
does to our body when we eat it. And it's known to cause inflammation. And a lot of people think like, well, if I don't have celiac disease, which is the autoimmune disease that's triggered by eating gluten, they're like, well, if I don't have that, then it's okay for me to eat gluten products and wheat based products. But I found with my patients that if they go gluten free, they actually feel better, and sometimes their
mm,
inflammation decreases. Like they have arthritis or joint pain, actually gets better on a gluten free
right.
diet. Another food that can be a trigger is dairy, and there's many theories on why dairy has become more popular as an allergen. Um, could be a lot of the hormones that they do put into dairy products.
Yes.
Um, from a even Chinese medicine perspective, dairy products like milk or cheese are very damp producing in our body. And so people who have eat a lot of dairy, they may have more sinus congestion or even allergies. And this is the product of eating dairy. It can make us more damp or congested, or even have digestive issues as well. And so dairy is another category they see a lot of people being sensitive to, or even have an actual allergy as well. Those are two of the common ones.
And they're very, very common. This is food that's in
Mm.
almost every single person's diet, and you can easily miss it.
Yeah.
So throughout your career, what would you say has been your biggest success, both in business and as a woman?
Probably in business is actually when I was going through naturopathic medical school, I did not think I would have my own business. I thought I would join another clinic and just work for somebody else. And so now I've had my private practice about 8 years now. And so I think that just taking that plunge and knowing that that was the right step for me to do, and still be able to do it 8 years later, I'm really proud to say that I now have a very successful practice that I enjoy doing. For me personally, I would say one of the main things that I had to overcome is I am a shy introvert. And that was a big, kind of still is in certain situations, a hurdle that I have to overcome, because not only being a business owner, but a practitioner, you do have to interact with people. And I know introverts, we sometimes don't like doing that. But I had to put myself out there as a business owner to let people know that my business existed, and that was going to networking meetings and doing presentations and seminars. And I had to work a lot on personal development. And one of those things that I did was going to improv classes. And I would say that that was one of the best things that I possibly could have done, because it has helped me to overcome some of the challenges that being a shy introvert comes with, is interacting with groups of people and being really confident when you're talking about what you do.
That's amazing. It's amazing. So
Yeah.
sometimes you just have to feel that fear and do it
And
anyway,
do it.
right?
Yeah.
Yes.
Mhm.
Fantastic. Now let's go to the other side of life and the areas that you feel were failures, if you like. What would you say were some of your failures, or one of your failures, that you feel you could have done something differently?
I would say going kind of way back before I knew that I wanted to become an acupuncturist, I would say I didn't listen to my intuition in what I should be doing. And I think I let other people in my life kind of guide the decisions that I was making, thinking that I was making the right decisions going through college, that, yeah, I want to go this route, but it really wasn't what I wanted to do. And so I think that was one of the things that if I was a little bit more aware of maybe what the intuition feeling was back then, that I would have taken the right steps for me, instead of being really um, affected by what a lot of people told me that I should be doing.
Now let's touch on intuition,
Hmm.
because it does help in life in so many different aspects. And
Hmm.
especially for women, we have it. It's like a sixth sense.
Hmm.
And the stronger you use it, the more you use it, the stronger it gets. And the stronger it gets, the more you use it.
Yeah.
How does your intuition talk to you? Because it's different from woman to woman, right?
Hmm. For me, I know that something is maybe the right next step, or the decision I should make, when it feels good inside. And I describe it as a light. Like, I feel really light, and it was so easy to make that decision. That's how I know that I'm listening to what I should be doing, because it's really easy. And that now I can really tell the difference if I'm faced with maybe an opportunity, and there's just something about it that maybe um, internally feels slightly off, or that I'm unsure about, or even that it causes some anxiety. I know that maybe it's not the right decision. And for me, I usually take kind of a step back and I think about things for however long that is. Sometimes it's hours or even a day, where I can clearly see, is this the right choice for me? And usually when I know that it is, like I said, it just comes so easy and naturally. That's how I really know that I'm really listening to my intuition and making choices that really resonate with me.
That's interesting. It's almost like you just have to be in the flow of
Yeah.
what's coming. And when
Hmm.
you feel that resistance, you're going the wrong way,
Yeah.
correct?
Yeah, exactly.
Interesting. For
Mm-hmm.
me, it's a little voice that I hear in my head sometimes that say go left, go right.
Mm-hmm.
Sometimes it percolates through my dreams. So
Mm-hmm.
it's really fascinating to hear from different women what that actually means.
Mm-hmm.
So I'm going to go back a few steps and back to your medical practice again,
Mm-hmm.
because I really want women to know what alternatives are out there.
Mm-hmm.
Now, if somebody was to go onto Google and look for you, what kind of keywords should they be keying into a search engine to find
Mm-hmm.
your methodologies? What exactly do you offer?
Yeah, that's actually a really good question. If somebody is looking for maybe an alternative or something more natural, those would be some keywords that I would put in. So, not that you would need to search acupuncture specifically, but it could definitely help guide you to find acupuncturists in your area. But if you say have, let's just use back pain as an example. If you search natural back pain treatments in my area or near me, or alternative pain management, those would be some keywords that may guide you to finding a different practitioner in your area. But definitely searching for like acupuncturist near me or natural medicine near me would be some things that would let Google know exactly what you're searching for. If it's more women's health related, I would say be more specific as you can, because there are a lot of alternative providers that do a lot of writing and blogs on different topics. And so that will also help Google match you to more people in your area. So that could be like natural PMS treatments near me or natural fertility acupuncturist. That will help guide you to some local people.
Now, the world being flat the way it is because of the internet,
Mhm.
are you helping people remotely, internationally, or are you only focused on people in your physical
Mhm.
location?
I primarily do see more local people, but I do offer some online courses, and I do have some people who live various places around the United States that can have
Mhm.
access to those. And so that would be a great alternative for many different businesses to offer a couple different styles of treatments on how you can help
Yes.
people via telehealth or online courses or online group programs, um, and or seeing people in person. There's so many different ways now to help people, that it's really great.
That's awesome. That's really good to know.
Mhm.
So now I'm going to ask you two of my last questions. If time was an illusion and I could take you back to the younger you, that young girl who was struggling with her health, trying to make a decision with her profession, and you could go back to her and give her three nuggets of wisdom based
Mhm.
on what life has taught you.
I would tell myself to just do it, um, instead of thinking about it or wondering if that was the right decision, um, or even worrying about what maybe people thought about the steps that I was taking. Because um, 15 years ago, now that I decided to do this, my family did not know what acupuncture was, and they were really um, kind of hesitant on me making that choice. And so, if I could go back and tell myself that just do it, it's going to be okay. Um, that's what I would say.
I love that. We do hold back a lot of times in life. We don't
Mhm.
trust ourselves. We don't trust the gut feel that we have.
Mhm.
Thank you for that. So
Yeah.
now, with the same kind of thinking, if I could teleport you into the future
Mhm.
and you could sit and have a conversation with the 100-year-old you, that amazing woman who's helped so many people's lives, so many people with their health, and you could have a
Mhm.
conversation with her, that wise sage, that wise woman, what
Mhm.
would you say to her based on how you are living your life right now?
Mhm. I would say, like, dream. How did you get to dream bigger? And I know that the vision that I have for my practice long term is a really big dream on serving more and more people. So I know my 100-year-old self would be thinking about how many people that I was able to help. And so having steps on how to reach that vision, maybe some clarity, and um, not having any regrets on taking big steps in my business in order to get there, would be some advice that I would want to get to make sure that I'm doing that in the right way.
I love that. And the interesting thing is, I think you already have all of those answers. They're already in you.
Mm-hmm.
I do that a lot. When I'm trying to figure things out, I go into a meditative state and I just ask myself the question, how did we do it? Because the
Hmm.
future me already knows she's done
Yeah.
it, right?
Yeah. Mhm.
I love it. This has been a
Mhm.
fascinating interview.
Mhm.
So, did I leave out any questions that I should have asked you? As an interviewer, you think you have thought of
Mhm.
all of the best questions and you have this
Mhm.
interesting person in front of you and you might
Mhm.
miss some really good nuggets. Could I have asked you
Mhm.
anything else?
You asked really amazing questions. I would just have to say that if there's any women out there who maybe just don't know what they want to do, or maybe kind of feeling stuck, to know that there are so many opportunities out there that you may not think of are available. And I know that was my story, um, being a chemist and then switching careers to become an acupuncturist. I didn't know that at that time, one, what you really did as an acupuncturist, but that there are lots of women in that field, and there is probably more women acupuncturists than men. And so, just to put that out there, is there are so many opportunities now for women in all different fields, and you just have to go for it
And trust yourself.
and
I
trust
love
you.
that. Thank you so
Mhm.
much. And thank
Mhm.
you to everybody who's tuned in today from all over the world. The Her Story movement is looking for fascinating women with fascinating stories to uplift, inspire, energize, and educate. And so, Dr. Ellie, thank you so much for gracing us with your presence this morning.
Mhm.
Have a fantastic day wherever you are, people. I'll be back again tomorrow. If you are wanting to share your story, go onto our website, theherstorycircle.com. Register to speak. We are having so many events between now and the end of the year, and we are looking for your story. Don't go to your grave with your story. Thank you, Dr. Ellie.
Thank you.
Bye for now,
Mhm.
everybody.